So a very warm welcome to our respected speakers, Mr. Manish Chan and Dr. Rajiv Pillai. I will just give a quick and brief introduction about Mr. Manish. Mr. Manish has more than 23 years of experience in healthcare management, banking, finance, and insurance. So he has been associated with the ICICI Bank in the initial phase of his career. Then he continued with SDFC Bank, and then he moved to Esther DM Healthcare. So, and gradually he moved to this Avivo Group as a general manager of operations. As of now, he is heading Burjeel Hospital and the capacity of Chief Operating Officer. So Burjeel Hospital is based in Abu Dhabi, and it is one of the largest and one of the most advanced tertiary care center of excellence for healthcare in entire Middle East. Warm welcome to Mr. Manish. Good evening to you.
Thank you, Piyush. Thank you for having me here. It's my pleasure.
It's a pleasure. Our next speaker is Dr. Rajiv Pillai. So Dr. Rajiv Pillai is MBBS from TD Medical College, Kerala. And after that, he did a master's in medical. And then he pursued his master's in business administration from University of Atlanta. He has been working with a prestigious hospital of Abu Dhabi, which is Universal Hospital, for 4 years. And then he moved to Burjeel Hospital. So currently, Dr. Rajiv Pillai is heading the marketing and business development at Burjeel Hospital, Abu Dhabi. A very warm welcome to you, Dr. Rajiv Pillai.
Thank you, Piyush. Thank you for having me with you. It's a pleasure.
It's a pleasure to have you here. So, okay, now I'll hand over to Ms. Mridula to take over the session.
A very good evening to you all. Welcome to our next session, Ignited Minds. I'm your host, Mridula Pandey. Hope you all are doing good. Stay safe, stay at home, and stay healthy. You know, someone beautifully said, we cannot choose our external circumstances, but we can always choose how we respond to them. Correlating with these beautiful lines, we are joined by our special guest, Mr. Manish Jain and Dr. Rajiv Pillai, who are going to share their valuable experiences with us in this platform today. As we are going to have some beautiful conversation with the visionaries present here, I would like to tell you that if you have any queries, you can use our chat box option. Our guest will address your question here. So without wasting time, my hearty welcome to our guest today. We are super delighted to have you both here, sir. As Piyush sir already given your introduction in a nutshell, I would like to begin this session with my question to Mr. Manish Jain. So you have instrument growth of many healthcare organizations. Can you please share your professional journey so far? What were the up and downs, lows and highs, and your challenges?
Thank you, Mridula. Yes, professional journey. If you look at transition, for me, it was a big transition moving from banking to healthcare. There were big challenges. My dad comes from a banking background. And when I decided to move to healthcare, that was the biggest challenge. Knowing that I've done extremely well in banking, I can definitely keep growing in banking. Then thought of moving into healthcare. Healthcare is challenging, more challenging than banking. Banking is much more organized industry for more than 300, 400 years. Right systems, right processes, strong audit, strong risk management. Healthcare definitely requires that, and been thinking that yes, healthcare is the next sunrise industry where you can actually bring in many things which banking had already in place. I was just an executor in banking, but when I think of healthcare, you get an opportunity to actually go and take over and bring a lot of changes to the system. Most complicated. I've been in the healthcare for the last 12 years. Whatever I could do in banking in 12 years was much easy, but it's most difficult in healthcare. In healthcare, you actually manage a large number of challenges, and basically you're dealing with an information which is quite critical, confidential, and it will vary different perspective. And bringing them together is one of the biggest challenge. The first challenge was moving from banking to healthcare, not easy. First 2 years I've been tremendously depressive. I mean, I was in a situation where I need to learn from again zero. So I had to start from zero, biggest challenge. But those 2 years were like going back to school, going back to college, and getting into domain expertise. And those 2 years were fruitful. I'm quite happy that yes, I moved from banking to healthcare. Challenges still continue. More you get deeper and deeper into healthcare, you learn there's a lot to do. There's a lot to develop. But so far, so good. It has been a wonderful, enterprising journey. Growing in the ranks, not easy in healthcare, where you're coming from a non-medicine background. That was one of the biggest challenge. But then, understanding the nitty-gritty of healthcare businesses, taking deep roots and getting into it was one of the biggest challenge, and which I could make it out. Most important good thing what happens, what actually has happened with me in the healthcare journey is people. I come from a background where good people management, and I understand that that's the biggest asset any organization will have, either in banking or healthcare. It is a good set of people who actually build a good organization. So when you build a good people around you and you nurture them, bring them to their potential, and allow them to grow, allow them the opportunity to perform. It's the same thing which I replicated here and made a good success here, brought in a lot of growth among them. And when you see that people under you grow and go beyond your capacity, you feel so happy for that. You build a strong network of professionals among you, and then that's how you do it. Spend a lot of time in Aster. I spent more than a decade in Aster. That was my first healthcare stint. Dr. Azad Mupan, great leadership, a legendary person, and that actually helped me a lot in understanding healthcare. I was managing few clinics, and then I started managing huge number of clinics. So I started this journey with Aster, with a small set of units, and then growing them to the bigger. I worked until the IPO, and that was a great journey. 10 years working with an organization from a small, medium, large, seeing the whole journey, and seeing that a unit where you're working for more than 10 years and getting into a listed company. So that was the biggest achievement. Prior to that, you were already working with a listed company. So you really don't know how it really works to introduce a company and get them into a listing. Being into operation risk management was one of the greatest opportunity for me. And that's one of the most important aspect when you want to, or when you decide your company to getting into an IPO. Bad part is the sacrifice. You know, you do a lot of sacrifice on a personal front. Growing healthcare business, working hours are like, we are 24/7. We are always ready. We don't have any, I mean, the commitment towards my social life is zero, I would say. We hardly get time. We are always available 24/7 for the organization, for the patient care, staying away from family. That's the miss. But at the end, the satisfaction what you bring in, that saving life, saving somebody's, the key requirement, you know, that is about health. That drives you big. And these are the highs, lows, bad and good and bad about my journey.
Thank you so much, sir. It's really a tremendous journey. So coming to Dr. Rajiv, sir, can you please share with us your professional journey so far?
Yeah, Mridula, yes. Basically, being in a healthcare industry, or when you are a child, you start your schoolings, you have aspirations to grow, and as your medical profession was one of the most lucrative in those times when you choose to become a healthcare professional. So your dreams were built upon becoming a doctor. So that's how the entire, even the schooling system. So you are very much focused. Parents were very much focused in making their child a doctor. So that was a dream for me and my family. Especially, I come from a background where my grandparents, my grandfather was an Ayurvedic practitioner. So from childhood onwards, those caring for someone, making an impact in someone's life was part of the philosophy or the value systems we believed in, and we have been brought up with. with that aspirations, did schoolings, got good grades, got into medical education, which was not that easy at that point of time. Was aspiring to become a prolific practitioner, dream which we during our training years. Um, Further to the completion of my medical studies in 2002, back in Kerala, had aspirations to grow the career. And in life, there can be twists and turns, and our decisions and our aspirations can change at times. So my thought was to continue in India with Indian healthcare market, have a promising future, doing the PG and then continuing as a clinical practitioner in Kerala was my dream. But due to certain circumstances and family commitments, I got married and married to a girl who has never been much in Kerala. They have been born and brought up in UAE, so their aspirations and their comfort zone was more into leading a life more in UAE than going back and settling in Kerala. So weighing the pros and cons and risk and rewards, you make a decision to move to a new country, and that's how I landed up in UAE. Came to UAE 2010, started my practice as a clinical practitioner, as a general physician. But I was, to a certain extent, I was always of an, a personality, learn, seek opportunities from others. So that was the driving force always behind me. And that initial level of clinical practice was not giving me the satisfaction in my career growth as such. So I was looking for more opportunities. I was attending trainings and developments, personal development trainings, leadership development programs. I did my master's in healthcare management from University of Atlanta, and then I decided to move into the management aspect, which was again not an easy decision, because you aspired all your life to become a clinical practitioner, and suddenly you may. But again, as Mr. Manish mentioned, to convince your near ones and close ones is very difficult. You make that decisions to move. But fortunately, I was able to do that, and I started until 2018. I was continuing with my practice, and once I finished with my MBA, then I moved full time into the management aspect of it. I may, due to my whatever growth I have achieved in my working in healthcare sector, I attribute it to the employers who have embedded us and the training and the support systems which have been provided. Especially me being part of a new hospital set up in Abu Dhabi, you had multiple roles to play. Multitasking was the key hallmark of growing in your career. So there are opportunities, ample opportunities to you, how you choose it, and how honestly and how committed you take it as a challenge. I always believe that as a gift within, it's all about you exploring. Without going through that challenge, you cannot explore that. Willing to take up the challenge, and in turn, I was able to understand what is healthcare industry, moving from a clinical practitioner to understanding the market dynamics, business strategies, client relationships, account management, and things like that. So that have helped you to evolve as a better person and gaining experience in different areas of healthcare, not only from a business development and marketing perspective, but the overall understanding of the healthcare, regional requirements, regulatory requirements, a diversified culture. So that was my journey, and currently with Burjil is part of VPS Healthcare, which is one of the frontliners, in healthcare in this region.
That's really great. I mean, so we have one person, Mr. Manish, who actually transformed or took a big risk from shifting from finance to healthcare. And then Dr. Rajiv, who actually, was moved somewhere by destiny and who took a big transition from clinical practice to management practice. And that's what we call, that healthcare industry is so small, somewhere you all currently linked together. So that's really amazing. I mean, listening to your personal stories and how you have actually grown, that's really inspiring. So our next question goes to Mr. Manish. So Mr. Manish, like after this COVID pandemic, like It's, I think, almost stable in Middle East, or I would say Dubai as of now, UAE. So when it actually happened, so what was your first response of the healthcare industry in Dubai to the pandemic? I mean, we have heard that government also supported a lot on every front, and then there was an equal participation from the private sector as well. So if you could just tell us something about that, how did the public and private sector together handle the crisis? Any kind of changes which you made in your business model, or how did you adapt to all these things?
Yes, Piyush, thanks for throwing wonderful question. Being into Gurjeel for last almost 3 years, a wonderful hospital, wonderful organization, uh, and most importantly is the leadership. Our chairman, Dr. Samshir, the way he drives this efficiently, passionately, and being a part, and he is on the ground. He visits hospital often, and then being a part of the team and encourages, pushes us to get into the best outcome. And if you look at the first response when the pandemic hit us, we were a little anxious how we're going to handle this. There was no clarity. We never knew what is the severity coming up, what kind of number we are going to face, what is the capacity. And with all those developments, the first important challenge that we faced is the PCR testing. You know, that was the biggest challenge to see that how, and first response was to be an fast mover advantage. You know, you have to be fast, quick in getting that technology at home, which is Abu Dhabi. We have largely based in Abu Dhabi. And that was the biggest challenge because most of our clients were eager to know how is this PCR testing going to happen. At the initial stage, uh, we were taking around 48 hours or 48 to 50 hours to get the results. And then that was biggest challenge which we had to face. And we look at regulator, the strong regulator. Abu Dhabi has got one of the best. Dubai has got one of the best regulating system, which worked closely to ensure that to set up a PCR lab, that was the biggest. And we, as VPS Healthcare, which had a hospital which was coming up, a 400-bedded hospital, Gurjit Medical City, uh, comprehensive, the best hospital for the cancer care, which was open, which was still under the last phase, the final phase of the you need to complete. We in 3 to 5 days, we ensure that this hospital is open to serve the COVID patients. The 400-bed hospital was kept open uh, to ensure that we take care of COVID patient, and then to move all the patients to a central pool, because that's very important. Burjil Hospital itself is quite a busy hospital. In spite of medical city, we still had to manage our patients at the Burjil Hospital as well. We had converted one of the ward into a COVID ward. Uh, Many challenges, you know, especially when you look at the hospital, which is centralized AC environment in this part of the world. The biggest challenge is how do you manage negative pressure? The engineering team at our end, the in-house, looking at quickly changing uh, the requirement. Negative pressure is something which is very, very important to ensure that being a centralized AC, one room, when you have one room, one inpatient having COVID, and then you have a central AC, can actually create a big issue. And that's where our engineering team, with all the expertise, we improved the infrastructure within no time. This all happened day and night within no time. Public and private partnership, yes, one of the best important role which we saw that how public and private actually bring in the change in it happens in no time. You know, there is no time to bring up a circular. There is no time to bring up a new regulatory system. And we had a command center which operates on daily basis. We have daily briefing coming up from our team and talking to the regulator and regulator comes up with what are the initiatives, and we were equally hand in hand in running this show. We're able to manage the situation very well. The protocols, patient management, administration of vaccination when it came in, that was one of the biggest aspect of ensuring that vaccination. We played very important role. Open up. We went on to a lot of public places to open up a vaccination center to ensure that we move quickly towards this activity. And I would say that UAE could be possibly a good case study on how effectively the pandemic was managed, especially Abu Dhabi, the city of Abu Dhabi, the way it was managed, the way it was controlled, the way it was um, partnered by public and the private partnership. If you look at the changing business model, the thought changed, thinking from purpose over profit. Ensuring the safety of frontline healthcare workers was most important. We were exposed. I remember doing PCR test every week PCR test. And I would remember the one instance when the first PCR test was, and I was actually having cold and fever and was so feared. There's a fear that and just imagine this situation happened with everyone who went for their first PCR test. It was really trauma. The situation was, I was full of fear. I was exposed to the environment. I was going around everywhere, ensuring that the ground is ready. And when your first PCR test was done, waiting for 3 days to get the result, I was isolated for those 3 days. Even the result came negative, but those 3 days are the days where I think everybody would have gone through that. The fear that what is the result and how I'm going to tackle this. And this is something which, as a healthcare player or a provider, needs to come back to the patient and give that confidence. So whenever we had a patient when comes up with a positive, we interact, talk to them, often connected to them, and ensure that builds that confidence. And most important is the leadership. Dr. Samshir, our chairman, have been instrumental in driving this change. The whole change was managed fantastically. We brought in a lot of changes. And as I said, the model thinking itself is changed, purpose over profit. There were situations where we're handling only COVID. And as a private player, if you handle only COVID, you are not actually making anything. You're just serving the nation. It is nothing less than a war where you stop everything and get into serving people. And that was something which we really seen during the pandemic, and we still continue doing well, extremely well. And I would say Abu Dhabi administration, public and private partnership is one of the best model to reckon. One of the fantastic case study which we can look into it. That's about we manage the crisis, and we are continue to manage them efficiently, effectively, moving forward to the next level of growth and efficiency.
On similar lines, that's really interesting, Mr. Manish. On similar lines, I just wanted to know, are there any changes in the way your healthcare business operates in Dubai or UAE, I would say, which you see that would be permanent going forward, maybe based on the changing expectations of consumer or changing, the kind of entire infrastructure and atmosphere this because of this pandemic. And I think it's going to be staying there for another 6 months or a year or so. So do you see anything new that would be stable or that would be going for a long term in the hospital industry now?
Piyush, new thing would be the decision making. So far healthcare management system, if you look at the regulatory, the decision making usually takes time, but the pandemic has opened up the dynamics of the regulator, the dynamics where regulator has actually come up and said that, listen, this is how the new system would be, this is how, and the kind of speed which they went into it, even we pushed into it and said that this is what requires, this is the call, and then regulator has been pivotal and making these changes. And I could say this will remain now. These things will not change. These things will now remain. The speed of making decisions, the speed of bringing the best which is required for the nation, for the people, that will move faster. That will continue to happen. And probably most important is moving from a sick care to the wellness care. That's something which is going to remain.
Yeah, that's correct.
That's something which will take, it is a learning which pandemic has given, which would have never happened in a century. This is the biggest learning which we carry forward, and this will continue. This will continue.
Yeah, so I think the gradual focus is from curative to preventive care. Now people are getting more conscious about their health, about their immunities and well-being. So I think that could be another key segment, which could be like a key focus of the healthcare industry or the hospital specifically. And as you have rightly pointed, the decision making, because though there was a lot of pressure, but the kind of new initiative, the innovativeness that has come into the entire ecosystem in the past 1 year since COVID has come, I mean, that's globally, I would say, has been really phenomenal. And somewhere it's like the decision making itself only which has actually helped to navigate this crisis through, and it is still helping out. Yeah, so that's really interesting. So Mridula, you have another question now?
Yes, sir. I have one question for both, actually. So, sir, I want to ask you both, like Dubai ranked sixth out of 46 destinations in Global Medical Tourism Index 2022-2021. What drives actually healthcare in Dubai and what separates it from rest of the world?
Yeah, Mridula, let me step in, and then Manish can add on to the point. So, if you see medical tourism, the global demand for medical tourism have been on the rise since 2015 onwards in this region, in India and all. It was well beyond that. So there's a significant demand for medical tourism on a global scale. The reasons being, some of the driving factors can be the aging population, the increased birth rates, demand for high quality healthcare in developing countries, the affluent people where their per capita income having where they can afford to travel around to get advanced healthcare. So globally, if you see, medical tourism is poised for a tremendous growth. By 2027, it is expected to be a $207 billion industry. From a global perspective, definitely medical tourism is poised for a great growth. Now, when you come into this region, especially UAE and Dubai as a hub for medical tourism, there are multiple factors which contributes that to that possibility of developing this region as a global hub for medical tourism. Thing which I want to always emphasize is the visionary leadership of this country. We should start from admiring their contributions in terms of developing this as a global platform, in terms of the policies, in terms of the strategies, in terms of attracting investments, bringing in world-class healthcare professionals, building up high-quality healthcare infrastructure, reimbursement models, financing. So it starts from the visionary leadership in terms of identifying that as a region we have a great potential, and if we bring in right policies, we can attract the medical tourism market to this part of the world. That's how it started. Now, if you look at the many other factors in tourism, one of the most important factor in medical tourism, there are two aspects of it. One is a wellness aspect of it, and one is a medical aspect of it. So, the industry is divided with the wellness tourism as well as the real clinical medical requirements. So, wellness is more about the lifestyle, fitness, lifestyle, stress, regeneration, cosmetic related things and all. So, that is one aspect where there have been significant investments going on in terms of, building up high quality healthcare facilities, bringing in the state of the art technology, and attracting physicians across the world, the high caliber, unique skill set physician to come and work with us. The other aspect, clinical or the medical aspect of medical tourism. Now, if you see the healthcare cost of some, complex surgeries, for example, a hip replacement, the hip replacement surgery in US can be about $25,000 plus, where you can get it done in Dubai or in less than $15,000. So you have a significant target population in the developed countries, established countries, where on the higher side compared to this part of the region. Yes, we will have definitely a competition from Asian countries, like definitely India is a huge medical tourism. Thailand, Malaysia, Singapore. These are some of the countries which may be able to compete with Middle East market in terms of the pricing structure. But considering the other aspect, other than the price or the affordability factor, there are few other factors also which drives medical tourism. The most important thing is the high quality services what we provide. or the clinical competencies of the advanced diagnostic capabilities of the facility, the world-class technologies what we bring to the region. So compared to the affordability, if you improve on these, still there's a significant traction toward people choosing Middle East as a medical tourism hub, especially UAE. Now, another factor which contributes to medical tourism in this part of the region, I believe, like, is the already established travel and tourism ecosystem in this part of the region, starting from the luxury hotels to the aviation networks, world-class aviation networks from Dubai and Abu Dhabi, traveling from any part of the world to this less than 24 hours. So that makes the conveyance much more easier. Tourist attraction destinations in terms of entertainments, luxury, relaxation, and all makes it a region of choice or a destination of choice for many travelers who looking for a medical or a healthcare solution. So these factors contributes a lot in terms of developing or establishing UAE and especially Dubai as a medical tourism hub. A lot of investments are coming toward. Government is really focused on bringing in the right policies, even relaxations in terms of visa regulations. So I mean, like, it's a collective effort of tapping into the potential of this region, identifying that, building in the right policies and strategies, attracting investments across the world, bringing in the latest technology, having the aviation network to connect, and the travel and tourism industry to support the medical tourism. These are the factors which are contributing to UAE and Dubai as in developing them as a regional hub for medical tourism.
That's really commendable, actually, the way UAE, I would say, has actually been able to attract the medical tourists from across the world. I mean, despite having challenges from the neighboring countries like India and China, I mean, who also have a large pool of medical doctors and a good medical facilities. So, and despite having the cost differences, I mean, the way Dubai has actually been able to ramp it up is really amazing. So, Dr. Rajiv, just one more question over the same lines. Like, are there any specific treatments or any specific specialities which UAE specifically focuses on when it comes to medical tourism? Or maybe the target patients, like they look for which countries when it comes to the medical tourism, who actually contribute to their major patient base?
Yeah, it's an interesting question. See, the medical tourism target populations are diverse. Their requirements are different. But from a healthcare perspective or a medical tourism perspective, if you look at the biggest demand is for complex surgical procedures. Say, for example, like orthopedics, thing, ophthalmology, eye-related problems, and surgical solutions. Cancer care is one of the another emerging at this point of time, because the population is aging. The baby boomers, if you see, look at them, the aging population is increasing, and by 2050 it is expected to double in the percentage. Considering those factors, cancer care is also becoming an integral part of medical tourism. And as we have the biggest or a regional hub for medical tourism, which is a Burjil Medical City, which is fully focused on the latest and the most advanced oncology care in this part of the region. So based on a specialty wise, I strongly believe these complex surgical cases plus cancer care can be for medical tourists to travel to this part of the world. Plus now with the COVID related changes or disruption which happened in healthcare industry, wellness and preventive healthcare is becoming also a priority. If you see the number of patients who have been traveling to India, say for example, alternate therapies like Ayurveda, homeopathy, Unani, wellness, tourism aspect is developing at a faster pace in this part of the region. So the real mix will be the wellness and the preventive aspect, plus the complex surgical and the cancer care is poised for a great growth in medical tourism in this part of the world.
Yeah, that's great. I mean, so thank you, Dr. Rajiv. So, Mr. Manish, my next question to you. We all, this healthcare 4.0 digitalization has actually become a buzzword, and everywhere hospitals are rapidly adopting these technologies. I mean, that's something like inevitable as of now. So, how far digitalization has been adopted by the hospital in UAE region? I mean, what is the current status, and what actually drives the uptake in this region for these technologies, and like which sector basically attracts the major investment, if I talk to?
Yeah.
So maybe, I mean, you can share from your own Burjeel Hospital perspective.
Sure. Yes, Piyush. Relatively, UAE is much advanced compared to some of the other markets in the MENA region. If you look at the technology adoption in UAE, is one of the best, I would say. I would go back to the 2 years, 3 years back when government introduced the Malafi platform. Malafi is a platform which actually works on an interoperability solutions, which connects all the HIS of different hospitals to one platform. This initiative started almost 3 years back. Uh, I think that's something great. I've not seen this before. And it's so complex. You are going to connect different HIS run by different big hospitals, medical centers, and connecting and bringing them together. It's basically a central depository. You know, a central depository for a healthcare data management is not easy. It is one of the most complex design which actually Abu Dhabi is able to manage that. Malafi is a platform which actually connects all the HISs, all the leading hospitals, or leading medical centers, diagnostic centers, and that is something which helped uh, the adoption during the pandemic. If you look at the PCR testing centers, now you have PCR testing centers across all this, maybe 5, 10, 15, 20. And when you have a platform which actually can bring in all the information in a one of the central depository, uh, is one of the best model actually, which has helped us to minimize the exposure. So there was an application which was done or introduced within no time when this pandemic hit us with the help of Malafi, and an application which actually collects the central information of all the positive or negative cases. And when you have collected this information and which runs on all the mobile application, you can actually look at working out what kind of exposure you are into it with. If you are a negative and you're walking across the street, and when you can see that the unknown person walking next to you hits positive in next 2 days, you get a call from the authority saying that you were exposed to a person who was positive next to you and you should quarantine yourself, get the PCR test done. This is amazing. This is something which was done in no time because of the Malafi, because of the adoption which government had already in place. uh, Something which, that's why today, if you look at Abu Dhabi, has got one of the least exposures, least cases which have been reported. That's because of the adoption of the technology. This is one of the area which actually helped the adoption of technology. The next area is when a patient walks in to any of the hospital with the severity or with a situation which is an emergency, he will not carry any information of where he visited previously, what kind of background he is coming from, what kind of issues he's been facing. Malafi helps this, especially in a patient or a customer reaches to the emergency and doesn't know what to even explain to them. And this platform helps a lot to understand what is his background, what are his issues, what actually has happened to him, and which will help this golden hour to take a quick clinical decision on how to manage this patient. This has been amazing. This is one of the best solutions adoption which has happened from the government point of view. Interoperability. Very few countries will have this kind of management. That's one of the best. Focus will be on emerging technologies like AI. AI is something which has been adopted at the private, at the public sector. We work together on different projects. One of the projects during pandemic was the population at risk. We managed a program called Population at Risk. it was a public and private project where government shared the specific data to the private players to look into the population at risk. We were connected through the system. Basically, it's nothing less than a population management. And when you have patients who are at high risk, especially above 65, we reach to them through telemedicine, through operability, whatever solutions which can. We also went to the next into arranging a teleradiology to ensure that the population at the risk doesn't have to visit the hospital during this pandemic, to ensure that their regular care is taken care. Basically, somebody who has diabetes, has got hypertension, has to refill their medication, doesn't have to walk into any hospital at this point of time, to ensure that regular care is taken care, home delivery of medicine, to ensure that this has been. So a lot of intervention adoption which we have seen in this last year since pandemic hit. All other, if you look at other areas which is actually going to help us is AI, adoption of AI. The highest non-show, if you look at the appointment system, I will go back to the simple system of healthcare is appointment. Patient will book appointment. And when you look at the no-shows are always high, 20, 30%. One of the mechanisms which can help reduce our no-show is AI. AI can predict my behavior as a patient. If I'm a patient who has a habit of no-show, AI can predict that this is a patient who has a habit of no-show, which actually saves a lot of, these appointments can be given to the needy people who are being coming to regularly meet compliance of meeting the appointment, compliance management. We will also look at machine learning. While also putting machine learning which can help the predictability of what is going to happen, or if chronic care management can actually help us in what is the predictability of what's going to happen to you, and how we can address to you real time, rather than waiting for your regular checkup in 3 months time, 6 months time. Probably we can predict that. And even we are looking at 3D printing is something which is going to be adopted. As Dr. Rajiv shared with us, when you look at medical tourism, the technology plays a very important role. 3D printing, especially for the orthopedic, prosthetic, is going to something which will design the specific requirement specific to the need of individual. And that's something which is going to help us in the adoption. There are a lot of other applications. Home care is one of the biggest opener of this pandemic. It's going to be a big learning way. So that's about the adoption. This region, I would say, can be compared to one of the best regions in the adoption. Extensive focus on digitization of healthcare services, public, private, and we are also looking at how we as a group, we have so many hospitals. Our challenge is to bring this all information together in a one platform. So there's a lot happening. There's a lot of adoption happening. We are working with top 5 of IT firms, top 5 IT consulting firm, to develop solutions which will help the future predictability, and how we can adopt and how we can make the best use of technology. That's what the move is from, as I mentioned earlier, the move is from the sick care to the wellness, how you can move and predict. And if you have a system to improve the wellness program, that's something which needs to be adopted. A lot of attractions, investments are going to happen in personalized care, focus on patient experience. A lot of trust is on patient experience. CX is something big coming up, providing digital interface for the communication. Those days are gone where people, for any information, walk into the hospital or walk into any center of information, they want on the tip of their button, mobile. That's something which we're looking at, interface for the communication, digitization, and most important is accessibility. While doing all the digitization, we talk about all these jargons. At the end, what patient requires is accessibility, providing greater access to the patients and the relatives. If you look at the pandemic, we had restrictions on allowing relatives to come and see the patient. So the next thing was how to adopt technology where we can connect them through the virtual meetings. You need not visit patient. You will take care of patient. You are on the safe hands. You don't have to visit and expose yourself to the hospital. We connect them with the virtual meetings to ensure that you can connect to your family member who is hospitalized. No need to visit, and we take care of them. That's the adoption of technology in improving the accessibility. And most important is affordability. At the end, reimbursement. How important that you bring this cost relatively lower. The healthcare has traditionally been expensive, very expensive when you compare it, and when you don't have a choice, you end up in doing. And digitization would help make it more affordable. What kind of technology enhancements? I'm sure the cost should come down, and this is what the requirement globally. When you're working in industry where it is insurance, your 100% is covered by insurance. At the same time, if insurance has to adopt, cost has to come down. So there would be a lot of affordability to ensure that you have best insurance product available in the market to ensure you covered and you taken care. This is in the nutshell about digitization and adoption.
That's really great, especially that Malafi thing which you mentioned. I mean, accumulating the entire data of the entire healthcare hospital ecosystem and then predicting the behaviors, and especially that no-show wala thing. That's actually one of the major pain points for the OPDs, actually, for the OPD managers. I mean, the no-shows, and then people are waiting in the OPD. Some people are missing their appointment. That's really created a big issue. So that's really amazing to know like how technology has been actually put to use in the healthcare system. And I think there's much more we have to see, much more to integrate going forward. Mridula, any other question you have?
Yeah, sir, I have a question for Dr. Rajiv. So, sir, can you please share some insights on the health insurance mechanism in Dubai? Like how different it is from Indian scenario and what opportunities lies in this sector?
Yeah, Mridula, basically, one of the advantages, I may say, that being in this region is that you are covered by a valid health insurance. So you don't worry much about your hospital bills. It's a great blessing. Again, I attribute this again to the visionary leadership of this country, the way they have planned it. And it has become in Abu Dhabi, if you see, it is a mandatory or a compulsory insurance to have. If you have to get a visa in this region, you have to first have a valid health insurance, without which you cannot get your residency in this part of the world. That gives a lot of peace of mind to anybody who comes to this part of the world as an expat, to having their dreams of coming and working in this region. He is fully covered on the health aspect of it. So that's a really noble thing from a strategy and policy perspective, which have been implemented and successfully being run. Daman is the largest insurance provider in this sector. It is funded by the government. Almost it covers a big chunk of the Emirati population, I mean the local Emiratis. And it also covers there's a plan called the Abu Dhabi Basic Plan, which covers the lower end or the blue collar workers of the community also. So it comes up with a comprehensive coverage. Whoever is employed in this part of the world will have a mandatory insurance coverage. Now, the good thing about it is that you can have quality healthcare access if you have a health insurance being provided to you by either by your employer or by the government if you are an Emirati national here. Insurance definitely with the growth of the healthcare industry, definitely the insurance sector is also vibrant and have a lot of potential opportunities for them also to grow from the investment perspective, as well as now we spoke about the medical tourism aspect also. Now there is a significant demand in terms of ensuring the international travelers, which can be another opportunity in the insurance sector, where when it comes to having coverage for international passengers and travelers to this part of the region as a strategy to improve the medical tourism development in this region. So from an insurance perspective, there's a robust system in place which supports in the reimbursement of the healthcare cost of individuals in this region, and it is poised to a significant growth because of the growth which is happening in the healthcare sector as such, as well as medical tourism, and with the new disruption which COVID have brought in, people have realized the importance of wellness and preventive healthcare. So one of the area, I believe, like from an insurance perspective, if you look at a case study or an example of insurance, most of the insurances are covered based on a principal diagnosis. Say, for example, you have a problem or a healthcare issue. You go to the hospital, you see the doctor asks for a chief complaint, he documents it, and based on that chief complaint, he have a provisional diagnosis for which he will do certain investigation, diagnostic tests, and the treatment, which are covered under the insurance. But if you look at the preventive aspect, if I want to do a screening, I'm not sick, but I want to ensure that I'm not sick and I want to do a screening, to a certain extent, it's not having a complete comprehensive coverage in all the networks of the insurance. Certain specific networks, a high-end insurance may cover it, the preventive, screening programs, but not in general. So with the new disruptions happening in the industry with COVID coming in and people realizing the importance of moving from curative health to preventive health, insurance industries are also poised for a major change in their policies in terms of covering and promoting preventive health, actually, which can lead up to a lesser healthcare cost, which eventually helps or beneficial for the insurance companies itself. So that is a direction which I foresee moving forward with the current developments happening. That's one direction which insurance companies and the policymakers will definitely looking forward to. Yeah, that's it.
So, how marketing in hospital has changed post pandemic, and what more changes do you expect going further?
Yeah, that's a brilliant question. I mean, like marketing, as basically healthcare marketing, as every other specialties or industry, I believe, like healthcare marketing is also evolving and going through a drastic change. Now, if you see from my perspective and the experience what we have gained and with the current market changes which is happening, hospitals or healthcare should be more focused on, promoting or helping or creating an awareness among the community about the clinical competencies than just looking like a marketing or a commercial advertisement in terms of their services like that. So it should be more awareness-based campaigns, which helps people to acquire enough knowledge and make a sensible decision based on the information they receive. So marketing, like any other industry with the advanced technological solutions and adaptation of digitization, there are a lot of changes happening in marketing as such. Now we touch base on the Malafi systems and the huge data on which we sit on. Now, if you see the big data analytics, AI coming into the picture, and predictive analytics can actually give a marketing a lot of insights about the needs of a patient well in advance. Say, for example, if I give you a case study, say, for example, a patient who is diabetic, okay, and you have a database of this patient who is diabetic since last, let us say, 2 years or 3 years. And based on the diagnosis of diabetics, based on the clinical evidence-based clinical practice, this person may have a potential to have an ophthalmology-related problem, eyesight-related problems. Yeah, he can have cardiac issues. He can have neurological problems. Okay, so this person actually who is a diabetic needs periodic multi-specialty consultations, which you already have the data with you. But if we don't analyze these data, and if we don't, so once the technological advancement comes in and you have a predictive analytics, which tells you this category or sector of patients needs awareness on this particular topic, needs periodic screening on this particular diseases, which help the marketing team to develop a targeted approach towards this community in terms of enhancing their knowledge as well as in terms of giving the exact solution for their problems rather than generalizing the marketing concept by promoting every service to everyone. So digitization, the big data analytics, the predictive analytics, AI's influence, everything is significantly impacting the marketing element of healthcare also. So I believe like future marketing is more about having predictive analysis and you understand clearly your target populations and their needs, and customizing the communications, marketing communication to that set of target population, so that you are giving a concrete solution to those who are in the need.
Thank you, Dr. Rajiv. That's really a great insight. So since we are almost nearing the closure time, I'll just take one question from our participants. Herman, you're there?
Yes, sir, I'm there.
Yeah, please put up your questions here.
Hi, good evening. Am I audible?
Yeah, you're audible.
Yeah, my question is to Mr. Rajiv, sir. Sir, I'm a dentist turned marketing professional and have passed out of IIHMR there for 3 years back. And one of the major challenges that I face whenever I interact with any HR or HR of any company for a sales or marketing profile is that it is very difficult to convince them that being a clinician for 4 to 5 years, then you can actually do sales. In spite of the fact that I have a decent experience of around 3 years from since 2018, since I passed out in marketing and sales for a corporate dental chain in Delhi. But still, it is very difficult to convince HR that yes, a doctor can do sales. Though I do field sales these days, and but still, it is very difficult to convince the HR. So, did you in the initial days of your career face such kind of problem?
Good question, Herman. You are taking me back to my initial, period when I started as say into sales and marketing. Yes, definitely in the initial stages, you may come across some of those challenges. But what I tell to my team members who are new, who start their journey in sales and marketing, one of the aspect I talk to them about is that the moment you start look like a salesman, it's very difficult for you to convince anybody to, for that matter, to especially from a doctor's profile coming in. So they may consider your skill sets are not suited for a sales. I always encourage people to go more into the learning mode and understanding in depth about the product from a scientific perspective, the future trends, understanding in and about the services you provide, the doctors you promote, the type of diagnostic services you offer. And the moment you switch yourself from a salesman to a consultant, that's where the game changes. Many times we try to sell ourselves as a salesman, which may not be appreciated if you come from a different background. But the moment, say, for example, I go and walk in to meet with a corporate client, I talk to them as a consultant. I'm not there to sell any of the Burjeel hospital services. I am here to improve your corporate wellness solutions. I'm offering you corporate wellness solutions, which nobody better can manage, because I'm a physician, plus I'm a marketer. So I have an added edge when I talk about medical topics to any corporate or even HR, because my understanding about healthcare, from a clinical practice, is much better than any sales person. Now, going through the process of learning sales and marketing have helped me to add another, qualification to my portfolio, which is an added strength, I believe. So in your case, I believe like you're perfectly poised for a great career growth. But the moment you switch yourself from a salesman's mode to a consultant, that is going to be the game changer.
So my second question is, since I handle the BTL activities, so I really am very curious to know that what kind of BTL activities happen in Dubai, if in case they happen.
Yeah, so basically, Herman, before COVID and post-COVID, it is going to be two different scenarios, I may have to say, because with the regulations coming in, there are a lot of limitations for many of the BTL activities as such. Healthcare marketing, one of the integral part of healthcare marketing was activities and events. Okay, where you organize events, you do, promotional activities in malls, you do it with corporate companies. And so with COVID getting into picture, especially in this part of the region, there are a lot of regulations for you to have and physical activity being conducted. So it has significantly reduced because of approvals and the risk factors and other things. That being said, on the other hand side, we got a great opportunity to connect with our clients through online technological solutions. So in the interim, in the transition phase, definitely the BTL activities will be slightly compromised. but I'm pretty sure in the long run it is going to catch up. And because now every industry have realized the importance of healthcare. Okay, now if I give you a use case example, one of the biggest corporate companies called ADNOC, which is an oil company in UAE, biggest oil company, we used to approach them for many of these type of activities and awareness sessions and all, which was not fully accepted, or they always demand that we are busy, we don't. So it was our requirement at that time to approach them and convince them to do an activity. Now we started to get calls from different corporates who used to reject us to come and do an activity, because they realize the importance of creating that awareness among their public and community.
Raju will join back. We want to continue with the further questions.
Yeah, so I have one questions to you, Mr. Manish. See, that's a very, very common question which typically we get from our students, that Middle East is full of opportunities, and there are a lot of people from Asian countries, specifically India, who are working in that field, healthcare. So, what is the right way to enter into the industry from a fresher's perspective, like a fresh graduate from in Masters in Healthcare Administration, and what kind of roles can they look for?
Yeah, Piyush, I would start with Burjil Hospital. Last year, we started the campus interview at your Jaipur unit, and that's how a Jaipur unit got connected to us and started the campus interview. I think best thing is the campus selection as a freshers. I'm sure the success what we got from this batch is amazing. Uh, it's on 100% at par with all the performances. Something which you've been talking to my friends in other hospitals, we have already shared the success story of last year's batch. They're fantastically doing well. They're growing, and this success story can be replicated. We are looking forward to have management trainees in all our hospitals. We started with Burjil Hospital last year. This year, we have decided that we are going to go up with all our hospitals with management trainee positions across. I think you can take from this one success story that VPS Healthcare, if VPS Healthcare can continue doing this, you can go back to all the healthcare players and approach them for
Correct.
campus interview. And there's a lot of requirement coming up, especially for the management trainees. For the freshers, the best way to start their career is getting into management training. And it's a fast growth. The growth is faster because we look at we check their performance every 3 months. Every 3 months, there's a performance appraisal, and they've been given the KPIs are given, the JD is given, and across. And every month, in the first 6 months, every month they have a different a project to look into it and to ensure that they get successful in these projects. And it is our duty to mentor them to ensure that they come up with the success. That's our responsibility. We also push them, and being a fresher, there is always an advantage to the organization also, because they perform to the best, because they don't have the background that this cannot be done. They only see that this can be done, and this is the game changer as far as management trainees are given us. Their approach is different. They never come back and say that traditionally this have never happened, because they have
Yeah,
not
they
gone
don't
to
come
that
with that
traditional
baggage
aspect. That
actually.
yes, so that helps a lot. That has created a good success story among the management trainees. We've been doing extremely well, and looking forward to get more management trainees on board every year. So that could be one of the area, and probably you can approach the lot of players here in Middle East to ensure that I'm sure your placement
So,
will be
any
taken.
specific skill set you look for, like an exposure to the Middle East industries, or the kind of working protocols, like we have discussed about the healthcare insurance. So they work on DRGs and other systems. So, do you expect something as a groundwork for them to have in their base when they come to this region?
That's very important, as you mentioned. If you look at Middle East or especially UAE, the DRG and A&M system, and these informations are available. There is a portal where you can go to Department of Health and identify what. Safafia is one of the sites which actually clearly gives a lot of information on the model which operates here. We've got a lot of data available there, which actually helps you to understand the model here. And one of the most robust system in the healthcare management, the regulatory aspect, the provider aspect, is one of the best robust system which we already have in place. So that will help a lot in terms of getting into this region, especially the Abu Dhabi and Dubai region. And one of the important aspect is that uh, it moves quickly on the development as far as regulatory is concerned. There are changes which happen often and regularly, and these websites actually gives a lot of information on what's happening in this region, and that can actually help the students to prepare themselves. And probably you can also look at interim projects with this area, this region in the focus, which will give them exposure on what's happening here. And I think today, coming to Middle East or coming to especially UAE, it's not that difficult. It's easy to come around here and get your interim projects.
So in these interim projects, any idea like what kind of projects typically they ranges to? I mean, in operations, marketing, or what?
I think it's open to all the sectors. If you look at hospital of our size, we look at operations, marketing, HR. We have separate lab management. We have separate radiology management. Nursing is one of the area. Patient experience is one of the biggest area which we can look into it. We focus largely on patient experience. Patient experience has been one of the most important aspect for us. If you look at when you enter Burjil, the first feeling is that you don't feel like you're entering hospital.
I've seen that. I've seen.
Yeah,
Burjil.
I'm sure if you have visited Burjil Hospital, you will not have an atmosphere of an hospital. It looks like you're entering a resort or a 5-star. Okay. It is not just the atmosphere, it's about the people also. Every touch point, when you meet every patient experience, resource of patient experience, people trying to help you out. They take you, they walk along with you to ensure that you are reaching the right department. As a size, it is so big that even if you depend on any signages, sometimes you will miss where exactly you want to reach. And most important is those personalized services which we encourage, the patient experience, the delightful. That's something which we focus. So we have a lot of more positions opening in patient experience. Patient experience has been fast moving. In fact, with this COVID pandemic, we've seen locals coming and joining the patient experience. Earlier, the Emiratis were quite reluctant to join this role. We can see there's a complete change. We find a lot of patient experience role being adopted by the locals, and we already seen this growth happening coming across. So patient experience is something great which we're looking at, and that's something which one of the area which your freshers can look into it.
That's interesting. So we'll focus that in our curriculum now. I think Dr. Rajiv is also here. Yes. So, Dr. Rajiv, you were telling something about this to Harman.
Yeah. So I think I have answered Harman's question, but unfortunately it got disconnected. But basically, my message to Harman remains same. I mean, Harman, it is all about switching from a sales mode to a consultant mode, for which you need more of determination in terms of reading, learning, understanding the product better. Getting into a consultant mode is what makes a difference. As I told you, the BTL activities will still keep emerging. Currently, with the COVID transition, it may have impacted a bit, but eventually that will improve also.
So one more question, like what kind of skill set? I guess Mr. Piyush was asking a similar set of questions, but I'll ask exclusively from the marketing point of view. So what kind of skill set do you look if you want to hire someone from, let's say, India or maybe a non-Arabic person? So how important is the knowledge of Arabic, and what other skill sets do you look at it for hiring a marketing person?
So before that, one last question, can we please address, like, it's a kind of, is there a chance for 2 months summer training for our students that Sarla ma'am put for?
We can look into it. We can arrange a 2 months summer training session.
Or but maybe online kind of.
Online would be difficult, Piyush. You need to have this hospital environment to really understand how the hospital operates.
We have one more question. I'll just quickly pick up the last question, that how can we apply off campus? Do Middle East country hospitals give chances to freshers?
Most of the time it is an arrangement between the institute and the organization, especially if you look at the freshers. largely it would be a campus selection. Piyush, if that's how it works at your end, mostly placements happen with the campus selection. But freshers can definitely apply. There's no harm in applying, but the best chances of getting selection is always a campus selection. I would always recommend to get selected in the campus. You should not have an opportunity to apply further. Probably you should have 4-5 offers in hand to decide where you want to join.
Okay, thank you. So students who want to join the class can please drop in, and I would request Mr. Harman and Dr. Rajiv to continue the discussion, and then we can quickly wind this session.
Yes. So Herman, so your question was regarding the qualifications or the skill sets needed to be part of the healthcare marketing team. So,
especially the language, Arabic language.
Yeah. Yes. So of course, see, if you really look at your career from a serious perspective in terms of establishing your career in this part of the region, I always recommend people to learn Arabic. It always give you an added edge the competition. Now, that being said, if you ask me whether Arabic is a mandatory requirement, I may disagree to that, because for me, say for example, I don't speak Arabic that fluently. I can understand to a certain extent, and it's all about now if you see this local Emiratis, most of them are well-educated people, and most of them speak Arabic. English language also. But definitely there is an added edge when you know Arabic, for sure. They speak, if you speak their own language, you will always have a better advantage on convincing them and closing a deal, for sure. But that's not a mandatory requirement to start with. You can start, and simultaneously you can work on learning that particular language and develop your career accordingly. For me, from a qualification perspective or a skill set perspective, basically I look at a person's attitude than anything else to start with. Okay, that is I believe like that's the most important skill set a person needs to have. Skill is a developable talent, but if you don't have the right attitude, no skills are going to help. That's what we have learned the hard way. So ideal candidate who is fit for not only for marketing, for any job, I believe like it should start from an introspection to have to ensure that we have the right attitude. We have the from a marketing perspective, communication skills are very, very important, and presentability. So these are the basic things. The rest of the things you learn as you grow, and your basic qualification will help you to do that. But the learning and the experience gaining aspect comes from the attitude aspect itself. For me, if I tell you, I never had any experience in marketing. Okay, I was never part of any even the management training and all. The curriculum helped me to get some insight, but other than that, everything shaped up due to the commitment which I have shown and the willingness for me to learn from anybody and everybody whom I meet. So when I sit with somebody, my initial thought was to milk them for information, to understand from them whatever I can. I go to a doctor, I sit with him to understand how I can best represent him, or how I can take his unique skill sets to the public. So without knowing what he is good at, without asking him the questions about what he is good at, or how can we market a product or a physician, is from the interactions and your attitude towards that effective communication. And you learn every time you do that. You keep learning. So it's all about the right attitude and the willingness to learn and the basic skill sets.
Thank you, Dr. Rajiv. I hope, Herman, your questions are answered now, correct?
Yes, sir. Thank you so much for giving me the opportunity, sir. Thank you.
It's our pleasure, Herman. Thanks a lot, Mr. Manish and Dr. Rajiv. I thank you once again for coming onto this portal and talking to our students and our alumni. That has been really a great insight for us. And we look forward for much more sessions and much more guidance from you. So thanking once again. Thanks a lot.
Piyush, thanks. It's our pleasure, and look forward to be a long-term partnership. We'll be coming to your campus as well.
Definitely, we'll be looking for it. That will be our pleasure to have
Thank you, Piyush. Thank you for having me with you. It was indeed a great pleasure to interact with you and your team. Looking forward to similar sessions.
Same here. Thank you. Thank you all the participants for their valid contribution. So Dr. Sadla, thank you, Dr. Sadla. Okay. Thank you. Bye-bye.